Hello everyone, a very warm welcome to all of you and thank you for being part of the Smart RN channel. My name is Henry. In our previous video, we looked at pneumonia and we considered its causes, risk factors, clinical manifestations, diagnosis and treatment. In our video today, we are going to look at the nursing interventions when you care for patients with pneumonia. So let's get started. Now, as a nurse, there are a number of things that you can do when caring for these patients with pneumonia. One, we have got assessment. Now, assessment is one of the ways in which a nurse collects important data that helps him or her to formulate interventions for their patient. Now, when caring for this patient with pneumonia, there are a number of things that we can assess in these patients. One, we have got vital signs. Vital signs normally provide very important information about the status of a patient at any given time. So as a nurse, when caring for patients with pneumonia, you are able to assess vital signs like oxygen saturation, temperature, respiratory rate, heart rate, and blood pressure. So these are going to provide you with the information that you use to formulate your interventions for these patients. Now, when you collect vital signs on patients with pneumonia, there are a number of things that are going to be clear. One, these patients are having tachypnea. You are going to realize that they are having an increased respiratory rate and also increased depth of respiration. Now, this is because the body is trying to compensate for the decreased oxygen saturation. Remember, patients with pneumonia experience decreased oxygen saturation. So the body tries to put in mechanisms to overcome that oxygen deficit. So the body tries to compensate by increasing the respiratory rate and also the depth of respiration. So patients with pneumonia have tachypnea. And number two, they also have tachycardia. There is increased heart rate. In other words, the heart is also trying to beat very fast to try and move fluid or blood in the body to supply the much needed oxygen to the tissues. Number three, you are going to find that these patients also have got decreased saturation of oxygen. Why? This is because there is impaired gaseous exchange within the alveoli. Remember, we said that with the pneumonia patients, there's fluid and exudate in the alveoli that impairs gaseous exchange in this particular patient. So they are going to have decreased oxygen saturation because of impaired gaseous exchange. Number two, because of also the tachypnea and tachycardia, which decrease the cardiac output. Remember, even though it is the aim of the body to try and increase oxygen saturation to the tissues, tachycardia and tachypnea always result in decreased cardiac output. And this one is going to have an effect on the amount of oxygen which is supplied to the tissues. Now, in assessments also, as a nurse, you are going to assess the breath sounds. And when you assess the breath sounds in these patients, you are going to discover that they have got adventitious sound. Now, you use your stethoscope to auscultate the lungs in this patient. They have got wheezing, they have crackles, they have rhonchi, they have rares, and this especially because of the fluid and exudate which is accumulating in the lungs and impairing oxygen exchange. Then you also assess peripheral pulses, the skin temperature, and the color. Now, one thing that happens whenever we are having decreased oxygen saturation in the body is that the body shunts blood away from the peripheral areas and directs that blood to the major organs of the body. For example, the brain, the lungs, and even the kidneys. So blood is shunted or directed to those areas so that our bodies can keep running. Now, when blood is shunted away from the peripheral areas, we experience weak pulses in those particular areas. We experience diminished pulses in the peripheral area. So when you assess patients with pneumonia, you realize that they have got diminished and weak pulses. Why? Because blood has been shunted away from those peripheral areas. You also experience moist and a pale skin, because blood is channeled away from those areas to the major organs to keep the body running. So those are the assessments that as a nurse you do in those patients who are having pneumonia. Number 2, as a nurse, ensure pulmonary hygiene in this patient. In pulmonary hygiene, the major aim is to mobilize the secretions. And when these secretions are mobilized, they become very easy for expectoration from the respiratory tract. So what do we do in pulmonary hygiene? Number 1, you will teach these patients how to use an incentive spirometer. You will teach them and show them how to use an incentive spirometer. And it's advisable that this patient should use an incentive spirometer at least 10 times every hour when they are awake. Remember, an incentive spirometer will help them to expand their lungs and improve their breathing. Number 2, as a nurse, you also teach them how to cough and deep breathe. You provide coughing and deep breathing exercises to this patient. So this cough and deep breathing exercises will help the lungs to expand, the lungs to improve in the gaseous exchange which is taking place in the alveoli. Another thing that you help this patient to do is postural drainage. In postural drainage, you help these patients to lie with their chest a little bit lower than the rest of the body. This helps the secretions to drain for expectoration. Then you also have vibration and percussions. You are going to perform vibrations on their chest and also percussions on their chest. These percussion and vibrations are to loosen those secretions and make them very easy to expectorate from the respiratory tract. And then you also offer these patients early mobility. Make sure these patients are out of their bed as early as possible. When it is possible, unless it is contraindicated, these patients should start walking. Now, the walking is going to improve ventilation, it is going to improve lung expansion, and therefore improve this particular gaseous exchange. So that's what you can do as a nurse under pulmonary hygiene. Another thing that you do as a nurse is patient positioning. Help these patients to position. Number 1, make sure the head of bed is elevated at least 30 degrees. This prevents aspiration of food or a drink or any other objects into the respiratory tract. Number 2, help these patients to turn in bed. Help them to move from side to side. And this is normally done maybe every 2 hours or even sooner. So you can make sure these patients turn from left, then after some time, turn them to the right. After some time, turn them on their back. This turning of this patient helps to improve ventilation and perfusion in their bodies. Now, we might also have a case whereby infiltrates are only found in one lung in this patient. If the infiltrates are only in one lung, help this patient to position in such a way that the good lung is on the downward side. So we say, position them the good lung down. So when the good lung is down, then movement of air in and out of this lung becomes a little bit easier. So they can actually ventilate and perfuse very easy when this lung is on the lower side. So help these patients to lie the good lung down. Now, as you continue to provide interventions, as a nurse, you can also provide or administer humidified oxygen. Remember, one of the main features of pneumonia is that these patients are experiencing decreased oxygen saturation. So they are going to receive supplemental oxygen. Now, when you provide this supplemental oxygen as a nurse, ensure that that oxygen is humidified. And this one helps to liquefy the secretions for easy expectoration from the respiratory tract. Monitor the intake and output in these patients. Monitoring intake and output ensures an adequate fluid balance. Now, this fluid balance is very important for 2 reasons. 1, it helps to thin the secretions. The fluid helps in thinning of the secretion. Remember, when the secretions are very thick, it's not easy to expectorate them. But when they have they have got adequate fluid in their bodies, then the secretions are thin and they become very easy for expectoration. Number 2, the adequate fluid balance helps with adequate perfusion. We are going to have blood volume which is required to move the oxygen within the body. So monitor the intake and output in these patients to ensure that they have got adequate fluid balance. As a nurse, you also perform what we call activity grouping. This is whereby you perform a number of activities at once when you come into contact with these patients. And the reason for this is to ensure that these patients have got adequate rest, because adequate rest enables them to conserve oxygen and energy. And then as a nurse, administer medications, administer antibiotics and any other medications which are ordered. And remember, we said in our previous video that with antibiotics, you must draw the cultures first. You must draw, if they are blood cultures, urine cultures, or even sputum, you have to draw it first before you start administering antibiotic. So this ensures that the cultures are subjected to test, and any identified bacteria or pathogen can help us to zero in to one particular antibiotic to treat this particular pathogen. So administer antibiotics as ordered, and also other medications like bronchodilators. Remember, we said that bronchodilators help to expand the airway or to dilate the airway for easy movement of air. So administer medication as ordered. Another very important thing that you do as a nurse is teaching. You provide teaching both to the patient and their families. And there are a number of things that you teach this particular population. One, you teach them the importance of hand washing. Hand hygiene is very important and is one of the best ways of keeping pathogens at bay. One of the best ways of preventing the spread of pathogens is by performing frequent hand washing. So you are going to teach these patients the importance of frequent hand washing and how to perform that particular hand washing. Number two, you teach them about the respiratory etiquette. What to do when they are coughing. For example, you tell them, cover your mouth when you are coughing. It is very important you cover your mouth when you are coughing. Number two, use tissue for sneezing and coughing. Educate these patients that let them use tissue when they are coughing and when they are sneezing. And also teach them to dispose of that tissue immediately and properly. This will go a very long way in preventing the spread of pathogens in the environment. So under respiratory etiquette, you teach them to cover their mouths when they are coughing, to use tissue when they are coughing and sneezing, and to dispose of this tissue immediately and properly. Number three, you teach these patients and their families the importance of adequate rest. You encourage adequate rest in these patients. And we have just seen that adequate rest enables these patients to conserve energy and also to conserve the much needed oxygen. Another thing that you teach these patients and their families is the importance of taking medications as prescribed. Now, this is very important, especially as it has to do with antibiotics. It is very important for these patients to take their antibiotics up to the last pill, up to the last medication. Now, inform these patients that even if they start feeling better, they should go all the way and complete all the medication. If you don't complete this medication, there are two serious consequences. One, incomplete medication will lead to recurrence of the symptoms. The symptoms are not going to go away. They keep on recurring. Why? Because those pathogens were never eliminated properly because the medication was not completed. So complete the antibiotics. Even if you start feeling well after taking the first dose, make sure you go all the way and take all the antibiotics. Number two, incomplete medication will result in the emergence of drug-resistant organisms. Drug-resistant organisms are very difficult to treat because just from their name, they resist the drugs. The drugs cannot be able to eliminate them. And when we have drug-resistant organisms, it makes these particular conditions even more serious. So the incomplete medication will lead to the recurrence of the symptoms and also emergence of drug-resistant organisms. So it is very important you teach these patients and their families the importance of taking medication. Teach the families to help their patient to take the medication as prescribed. Now, you also teach them about proper nutrition. Remember, nutrition is part of the medication. It is also part of the treatment. So teach them about proper nutrition, a balanced diet with enough protein or with adequate proteins for healing. Teach them about fluid intake. We have seen the importance of fluid intake. It maintains the blood volume to move oxygen in our bodies. It also helps to thin the secretions for easy expectoration. So teach these patients and their families about proper nutrition and also about fluid intake. Also, make sure that these patients and their families are aware of the signs of a worsening respiratory status. Remember, pneumonia affects our respiratory system. So you have to teach these patients about the signs of a worsening respiratory status, and this is to enable them to seek medical help as fast as possible. You are going to tell them about signs like shortness of breath. When they feel short of breath, let them seek medical advice. When they feel chest tightness, heart palpitation, remember we said we have got tachycardia, increased respiration rate, all those kind of things. When they have these signs, let them seek medical help, as it is going to interfere with their respiration. And then lastly, teach these patients about the importance of a pneumonia vaccine. Let them get a pneumonia vaccine to help and fight against this particular condition. And then lastly, we are going to look at the complications of pneumonia. There are a number of things, there are a number of complications that can arise from this pneumonia condition. One, we have got bacteremia. Bacteremia is when this pathogen, the bacteria now, enters the bloodstream. Now you can imagine now, if bacteria is in the bloodstream now, it flows everywhere in our bodies. It can be carried by the blood to any part of our body, to the brain, to the heart, the kidneys, everywhere in our bodies. So bacteremia is a very serious condition where there is now bacteria in our blood. Number two, another complication is scarred lung tissue. This is simply a lung tissue with scars. Now, sometimes when you aspirate stomach contents, they are acidic. And when you go to the lungs, they cause this lung to develop scars. And remember, a lung with scars will not be very, very adequate in oxygen exchange. So we might have scarred lung tissue, which is going to impair our oxygenation. Then we might also have pleural effusion, whereby fluid collects in the pleural cavity around the lung. This is not very good because it impairs the expansion of this particular lung. And in that case, you require to get a chest tube. A chest tube will have to be inserted to help drain this particular fluid out of the pleural cavity. Then we also have lung abscesses. Lung abscesses are going to develop because pus is going to collect in those cavities within our lung. And when you have got pus in the cavities of the lung, then that lung will not become very efficient in gaseous exchange. And then we also have atelectasis. Atelectasis refers to partial or complete collapse of the lung. Now, when the lung collapses partially, then that collapsed part will not be used in gaseous exchange. If the whole lung collapses, then you lose the whole of that lung. It will not be used in gaseous exchange, and that results in a very serious condition. And then lastly, we also have septic shock. These patients can go into septic shock. Now, septic shock is a very serious condition that is characterized by widespread infection in the body, failure of multiple organs, and a dangerously low blood pressure. This is a serious condition which, if not addressed in and on time, this patient is going to die. So septic shock is a condition whereby this patient will have infection throughout the body, failure of multiple organs as a result of this infection, and also a very dangerously low blood pressure. So this will cause this patients, pneumonia can cause this patient to go into septic shock and thereby lose their life. So those are the nursing interventions and complications of this particular pneumonia condition. So that brings us to the end of our video today. As always, drop a comment, like this video, share this video, and if you have not subscribed to this channel, I request you to subscribe today. From me here, it is a goodbye.